Good morning, Miss. My name is Chen Yong-seng. Today, I would like to give a brief introduction to corticosteroid. Corticosteroid is a type of steroid hormone that play an important regulatory role in our bodies. It's also well known as their strong anti-inflammatory effect to treat a lot of conditions such as asthma, allergy reactions, and also immune-related disease. Corticosteroid also come from two sources, which are naturally produced by our human body, adrenal gland, and also synthetically produced by human as a medication for clinical use.
Hi, I'm Fatiha and I'm going to talk about main types of corticosteroids, which are glucocorticoids and mineralocorticoids. First, we'll talk about glucocorticoids, which are primarily responsible for controlling metabolism and reducing inflammation. One of the most well-known glucocorticoids is cortisol, which is naturally produced by adrenal glands in our body in response to stress. Cortisol helps regulate our blood sugar level, metabolism, and immune response. Next up, we have mineralocorticoids, which are responsible in regulating fluid balance and maintaining proper blood volume. The primary mineralocorticoids is aldosterone, which works by promoting sodium reabsorption and potassium excretion in kidney. In the poster, we provide two examples of brand names of corticosteroids medication. First, Cortef, the brand name for hydrocortisone. It is glucocorticoids and commonly used to reduce inflammation and allergic reaction. Next, Florinef, the brand name for fluorocortisone. Florinef is mineralocorticoids and helps regulate the balance of water and electrolyte in the body, which particularly helpful when the body is not producing enough aldosterone.
Hi, I'm Lily and I'll be explaining further on the mechanism of action of steroid. So I'll explain further on how steroid actually works in the human body. So steroid basically enters the cell, and steroids are also known as lipid soluble, so they can easily cross through the cell membrane. And inside the cell, the steroid then binds to the glucocorticoid receptor, specifically in the cytoplasm. And this complex then travels into the nucleus, and in the nucleus it attaches to the DNA and increases anti-inflammatory proteins, and also decreases pro-inflammatory proteins, which is also known as cytokinase. And the final effect is that it reduces inflammation, suppresses the immune system, it decreases swelling, redness, heat, and pain, which are basically the symptoms of inflammation. So to further simplify the mechanism of action of steroid is that first the steroid enters the cell and then it binds with the receptor, it changes DNA transcription and also reduce inflammatory mediators. Thank you.
And now I will be explaining the usage of corticosteroids in radiographic examination. First, corticosteroids are commonly used to reduce inflammation. When tissues are inflamed, it can affect patient comfort and even the clarity of the image. So, by decreasing inflammation, steroids help to produce clearer radiographic images. Second, they are used to prevent allergic reactions. Some patients may develop allergies or even hypersensitivity reaction to contrast media. In these cases, corticosteroids may be given before the procedure to minimize or to prevent these reactions from occurring, to ensure the procedure can be carried out safely. Lastly, corticosteroids help reduce swelling, also known as edema. For example, in cases involving brain or airway swelling, steroids can decrease tissue edema, which helps to stabilize the patient and improve the overall quality and the safety of the imaging process. So, overall, corticosteroids improve comfort, safety, and image quality in radiographic examination.